1, 2, 2, 3. 1, 2, 3. In the place to be. In the place
Board 2 and Board 4, and I just wanted to start by thanking Miguel and Brad and everyone at Board 2 and Board 4 and everyone else who has been part of the coalition working on the community health needs assessment, and thank Judy and everyone else who is here tonight. You know, we're in a place where none of us wanted to be almost a year ago without the hospital in Greenwich Village, and I think we all can list numerous times when ourselves or friends or family have personally felt what that means not to have that hospital there and having to race to another hospital or worry if the fever doesn't break, how quickly can I get to the emergency room, or just not to have the folks in our neighborhood who are our friends and neighbors who've worked there for so long, and small businesses can tell you what it's like now around there, and it isn't a good situation at all. We've obviously had new developments today as it relates to what's been filed with the bankruptcy court. The plans obviously will unfold, and I think we'll hear some more tonight about them. I think Brad got it right. Obviously, our long-term goal is we want a full-service hospital back for this neighborhood. This plan, yeah, we also recognize that's not going to happen immediately. And we need to understand what this plan is and whether it meets what the community has articulated in the community health assessment that we need. Having this document is going to be very helpful in guiding us as we continue to move forward as it relates to the plan that's out there and as it relates to our long-term goal of getting a hospital back in this neighborhood. Now, Judy can tell us better than anybody. We're swimming against the tide here because there's other neighborhoods whose hospitals are now on the chopping block because of the Medicaid reform and other cuts in Albany. But that doesn't matter. We know what we need. We know what our long-term goal is. We're going to look at the plan through the lens of the short-term goals that the health survey is really going to help us focus on. So I just want to thank, on such a miserable night, so many people coming out tonight to help us keep our efforts moving forward. So just thank you all, and I just want to recognize Melanie LaRocca, my district chief of staff, and our board 2 liaison, who has been our point person on the community health survey. I'm running off to 2 other things, but they're going to stay for the rest of the meeting. So thank you guys very much, and thank you for spending so much time tonight.
Thanks, Chris. We're going to move now to a discussion of the community health assessment. Then we're going to discuss North Shore Long Island Jewish proposal. So we're going to do the assessment first, discussion, then we're going to have North Shore Long Island Jewish, and then we're going to have a period where people can ask questions or make comments about anything they heard tonight. Does that sound good?
From the second meeting on, I was advocating that we should be doing a community health survey, and not just at what was being proposed, and Diana can talk about what Hunter had proposed. I actually did the draft of the community health survey, so no matter what you hear, the community health survey came from the Commission on the Public Health System. We went back and forth for a long time about whether, and there were a lot of changes made based on members of the task force recommendations, a lot of very good recommendations. There is a survey that's online. The piece that I really pushed and wanted to work on even more, but remember that the idea and the initial survey came from the Commission on the Public Health System. I want to make that very clear because that's gotten lost in a lot of the discussion. You have these pieces of paper that were on the back table when you came in. The idea was not just to have an online survey, but for community residents to go out and interview people, particularly people that might not or probably would not be reached by an online survey. And Miguel and his organization have agreed to do this, and if all the details work out, that will happen. And I agreed to work with them. We will get somebody to enter the information, and I will work with Miguel and Jesse Campamore in doing an analysis and writing a report on it. I feel, I'd be happy to answer the questions, but again, I feel very strongly that, that this is a key part of any analysis. And I see Brad's going to put a help on me, so but I just want to say one other thing, and Speaker Quinn mentioned this. There is a Medicaid redesign team recommendations and proposals you may have read about. 79 recommendations that were handed to the legislature and they're told to vote on them. Many of them are very harmful and very damaging for communities and for low-income people, particularly people who rely on Medicaid for access to their health care. I have flyers of that, and I'll be happy to hand them out. I'm very sorry to say that Michael Dowling, the head of North Shore, was the chair of that task force that came up with the recommendations and actually pushed the vote on those recommendations before people could even digest what they were or really, see what they were. So the whole process has been the real problem, and hopefully, you'll see the information that I have and ask questions and perhaps get involved in that. So thank you very much.
Thank you so much, Judy. So just to be clear, Commission on the Public's Health System, Judy is the executive director of it. She's handed out copies of the survey. Miguel's going to be working on getting those out to community-based organizations, block associations, and other groups within the community. In addition to that, as Judy mentioned, we have a quantitative aspect of our survey, and Diana Rivera from the CUNY Hunter School of Public Health has been managing that part. Diana and her team have put together an online survey that's going to be emailed and distributed through a number of different elected officials' offices, community board offices, and other community-based organizations. And Diana's going to describe that process. Diana?
Thank you. And good evening, everyone. So I'm here as part of several people from the CUNY School of Public Health at Hunter College. That's not too close? Okay. So I'm with the CUNY School of Public Health at Hunter College. Okay, we'll try this again. Better? Okay. Good? We'll try that again for anyone who missed it. I'm with the CUNY School of Public Health at Hunter College. Several colleagues and myself were invited toward the end of last year to participate in this community healthcare assessment process that was underway. And what we learned was that at the time, some analyses of state-level data were taking place in terms of hospitalization and ER utilization. So our proposal was that we add to that a component of assessment of the community that got down closer to the level of individual experiences. And the steering committee agreed with that, and so what we've been undertaking the last couple of months have been a combination of activities. Key informant interviews with leaders of different community-based organizations that provide services, primarily health-related services, to members of the community. We've also been conducting focus groups with different organizations, as Miguel mentioned, with residents, with healthcare providers, I don't know what to do, and with providers.
Stand behind us.
Should I just talk loud?
Talk loudly.
Loudly? All right, we're going to try this again. Okay. Okay.
Hello? Hello? Yeah, it's working, right? Okay, don't move.
Interpret for me. Okay, and so we've conducted about a half dozen different key informant interviews with leaders of organizations in the area that provide a wide range of healthcare services to residents and to individuals who had experience with services at the hospital. We've also conducted focus groups and continue to do so. We have several more planned with individuals with special health care needs, people with disabilities, the elderly, people with special health conditions, etc. And what we hope this will do in our final report is add voice and add individual stories to the larger scale data analysis that I think Mr. Crabbe is going to speak to in terms of the utilization patterns of hospitalization and ER use since the hospital closed. So the goal is that these different sources of data and information will complement each other and give a very detailed and accurate picture of what the experience has been in this community since the hospital closed. So that process is underway, and I have to say it's going very well, and it is along the lines of the kind of work we do in public health that's a community-based participatory model. Everything that we're doing is being vetted through and influenced by and really approved by the steering committee before we go forward. To that end, and certainly along the lines of what Judy mentioned, we took up the task of helping in the development of a survey because many people felt that doing about a dozen or so interviews and focus groups was probably not going to get as much information since we're talking about hundreds of thousands of people who were served by the hospital. So toward that end, we've also helped in the development of a survey that will be, as Brad mentioned, disseminated through various organizations and elected offices via email, the internet, and paper. For those who don't have access to electronic, machinery, these organizations will also administer the survey paper in the old-fashioned way. Our expectation is that we're probably talking about several thousand surveys will come back to us that will assess people's experience before and after the hospital closed. And in that way, we really hope to be able to provide a very detailed picture of what the experience has been in the context of the closing of the hospital.
Nicely done. You chose exactly the right location. Thank you, Diana. So we heard from the team that is leading the Community Health Needs Assessment Survey. You're going to be hearing more about that as we move forward. And hopefully you'll get a copy, get your neighbors to respond, distribute it yourselves. And the more information I think we get, right, the more accurate our survey will be, and the better the case we can make for a full-service hospital in our neighborhood. So that's important. Now, we've had some late-breaking news today. I think it caught all of us off guard, but it's very interesting and definitely deserves some serious examination from our community. We're, I guess, fortunate that this meeting was scheduled because we're going to hear straight from the folks who proposed it. So Jeff Kraut, who's been working with us when North Shore Long Island Jewish proposed its urgent care center, which has just opened, is here now to discuss the new North Shore Long Island Jewish Center for Comprehensive Care. It's been upgraded. And we also want to ask Jeff about how, what exactly they're proposing. If it's an urgent care center, we don't want it. If it's going to be providing 24/7 medical assistance to our families, will people who don't have health insurance be accepted? What is the level of trauma that this center can accommodate? If you're food poisoned, will you be sent to this location? If your kid has a broken arm, will they be sent to this location? And finally, Jeff, I'd like you to tie in not just your plan, but also why the community health needs assessment is going to be important to you and your colleagues as you move to shape this new facility. So, Jeff Trout, ladies and gentlemen.
Thank you, Brad. I have the mark. Okay. So let me just comment about the community needs health assessment. It's okay. You know what it was? It was a loose driver. Okay. So let me comment just to remind everybody, because if you've not attended these meetings before, all of the information that has preceded what we're about to do as far as conducting the actual surveys is available on the website of Community Board 2. So all the data that was referred to about hospitalization, where people go to receive care, the community health status, what's happening both pre and post closure is available now on the website. And I suspect we'll have other opportunities to bring that together once we have the results of the study. We'll do a more comprehensive presentation. So what I'm going to talk about tonight is probably the first of several conversations we'll be having to discuss what's being proposed. And let me give you a little background in the history that so you understand the context of what's occurring, and you might ask the question appropriately, you know, how did this happen before we concluded the survey? So it's a good question. See, it's a good question, so I was right. So the issue is when you go back to when the hospital closed, the Department of Health issued a RFP to a request for proposals for providers to come into the area to do a variety of different things, to assume responsibility for some of the services that were previously provided by St. Vincent, and for individuals who wanted to come in to provide an urgent care center. And that's how North Shore LIJ was one of several institutions that bid and submitted a proposal and was frankly selected because of the proposal it gave. Now, you might ask, why North Shore LIJ? You know, what's the relationship here? And part of it is North Shore LIJ, essentially in May of last year, had a partnership with Lenox Hill Hospital and Manhattan the old Manhattan Eye Hospital. And we joined forces, and they became a member of our health provider system. And it's a fairly large system. We're in Staten Island, we serve Queens, Nassau, and Suffolk counties, and now we're also in Manhattan. And we didn't see this as the first step. It is just to kind of stay on the Upper East Side. But we saw this as an opportunity because of what we know in this city, and this unique opportunity, as devastating as it is on so many levels, and how tragic and you know that what occurred. The fact is there was a request for our assistance, and we felt that this was something that we would like to do. We would like to come into the neighborhood. It's to introduce ourselves and to get people to know us. So we put together, as I said, the proposal that was selected to develop the urgent care center. And as you just heard, that urgent care center opened this week on 121A West 21st Street. I'm sorry, 100 West 20th Street, okay? 121A West 20th Street. So what we did, and what we learned as part of that process of preparing that information was a lot of information about the health needs of the community. And all of that information that when we shared it with community groups and elected officials, they had indicated a desire to conduct this community health assessment. And they had asked us not only to provide all the information we collected, but also to assist the steering committee that was formed to collect additional information. And for the past several months, we have been compiling all the information I just referred to, and that's available on the Community Board's website. And we took a lot of that knowledge, and we understood, I think, although we don't know exactly what the results of the community health surveys, the surveys that are being conducted, we had a sense, obviously, there was an issue about people's concerns and perceptions about access to patient care. And there was a lot of concerns and fears expressed with particularly the access to emergency care and not urgent care. Urgent care serves a small section, but we're talking about an urgent care. emergency care. And what we ended up doing is we looked at this opportunity that presented itself as a consequence of the settlement of the bankruptcy of St. Vincent, is to do something that's never been done before in the city. Do something that's cutting edge, that's unique, and we believe will satisfy some, but not all of the needs of the community. And that is to open a 21st century freestanding emergency department. This is not an urgent care center, and I'll describe that in a moment. This is a cutting-edge emergency care center. This is going to have the technical expertise, the diagnostic ability, imaging, CAT scan, MRI, everything you would find in a contemporary emergency room. In fact, you may be surprised to learn that the facility that we're proposing in the old tool building is twice the size of St. Vincent's emergency room. St. Vincent's emergency room is about 10,000 feet. We're proposing a facility that's going to be 19,000 feet. And we think that facility will be able to accommodate some, but we think the majority of a lot of the emergent care issues that you experience. What does that mean? Abdominal pain, allergic reactions, anaphylactic shock, cardiac arrest, chest pain, concussions, ear infections, fractures, myocardial infarction, heart attacks, stroke, skin punctures, sports injuries, sports injuries, broken bones. The same things that this community has gone to emergency rooms for. And let me just tell you some of the statistics. The communities surrounding the hospital, 3 or 4 zip codes, that we refer to as the primary service area in the study we conducted. In 2009, before the closure of the hospital, there were about 27,000 visits to emergency rooms all over the city. Only a little more than half of the community residents actually used St. Vincent's. 55% went to St. Vincent's. The other people went to Bellevue, Beth Israel, NYU, Roosevelt, New York downtown. About 20% went elsewhere. So the amount of people who seek care at St. Vincent's was for a lot of the things I had described. Now, this emergency department will also accept ambulances. We expect ambulances to come and go there. The FDNY EMS system has a series of protocols. It's very sophisticated, there's sophisticated technology, and there are protocols where, like everything else, they triage. They look and assess the situation, and they take you to the place that they believe is most appropriate for the care. Again, for the majority of reasons, people come to an emergency room. And most of the people that I just spoke about, those 27,000, were people who were treated and released. Not admitted, treated and released. And so working with FDNY EMS, and they will be first validating that we can do what we said we can do, that we meet standards, that we cannot turn anyone away. This is an emergency room. Make no mistake about it. You will hear people saying it's a glorified urgent care. Nothing could be farther from the truth. There are 16 states in the country that now have freestanding emergency rooms. There's over 120 freestanding emergency departments. This is partly made possible by some of the changes that are occurring in healthcare as far as technology that make it safer to do this without a hospital. Think about what you would do if you went to an emergency room and went to New York downtown. Same analogy. The same capability that's available there would be available here. So if you come into the ER, and let's say we talk about a heart attack, that's the most common example that's given. First of all, there's 2 ways to come in. If you walk in, you may not think it's a heart attack. You may think it's back pain. And like you show up at New York downtown, if your clinical functions are elevated, if there is an indication that there's a heart attack, what do? They treat you, they stabilize you, and then if you need treatment, if there's a blockage, they will move you to a facility that could do that. This facility will be similarly equipped to do it. If you are having a heart attack, you're picked up on the street. The medics at that time can make a determination as to what level, where you're at, and take you to the most appropriate place. It may be the place we're proposing, or it may be a place where they think there's a blockage and they want to bring you to a place where there could be an interventional procedure. There's no reason for them to come to our place. But it would be the same decision they would have made if that occurred 2 blocks away from New York downtown. They may not have taken you there. They may have taken you to a place that has a higher level of care. And the same thing, obviously, for trauma. When you have gunshot, when you have, massive wounds, this center is not equipped for that. But then again, there are not many trauma centers. There's only 3 trauma centers in the city. So not every hospital is a trauma center. This entity will be able to essentially accommodate what a community hospital's emergency department would be able to accommodate. And so I think what we're going to be able to do, we have more, in addition to the emergency department that's going to be there, the building will have ambulatory surgery capacity for minimally invasive surgery that doesn't require an overnight stay. For people who we don't know exactly what's happening, we have beds in this facility in which you get observed, and we decide, then there's a clinical decision about whether you have to be admitted or you can go home. When a decision is made to admit it, that's a decision that's made with you. If you have a physician, we admit an individual to the hospital where their physician directs us to admit. If you do not have a physician, we will have arrangements with neighboring hospitals to transfer based on patient preference and what is your clinical requirements as well. The other issue, it's the rocket panel. Okay. The other issue that we have to address here is what else is in the building. This will also have an imaging center, which will have state-of-the-art diagnostic facilities to take care of ambulatory diagnosis and treatment. We will also have, there'll be a floor in this building that we're actually, we don't know what we're going to do with it. We're going to keep it open. Because what we're waiting for is we want to see the results of the study, and we want to see what other needs that are possible. So there's approximately 25,000 square feet in this building that could probably accommodate upwards of 25 doctors, who we are just going to try to keep that empty until we can finish the conversation about the community health assessment and see what other needs are appropriate in the community to either be in this building or, frankly, elsewhere in the community. Because we are looking to also develop additional programs and services that will be outside of the doors of O'Toole as well in this community. So we have, I suspect we'll be coming back and doing a more extensive conversation. We also, we have drawings, we can explain it. I don't know.
And your colleague?
Yeah, and I have Dr. Sama with me, who's our Chief of Emergency Medicine for North Shore LIJ Health System, and he can maybe elaborate more on the clinical issues that the center will be capable of handling.
Thanks very much for the opportunity to speak to you guys tonight. I'll try to be brief and very direct. I understand there's been a question and a concern about whether this is an urgent care center or an emergency department. I think what everybody here should understand and recognize is that you will be very proud, very happy to have what I consider to be a state-of-the-art 21st century resource to provide emergency care right in the neighborhood. You will have board-certified emergency physicians, all the equipment, technology, quality, safety, and processes promulgated by the American College of Emergency Physicians and New York State will be available to all people in the community. You'll be able to take care of whatever presentation or symptom anybody presents with, from pediatric to geriatric, and then we can make an appropriate evaluation, assessment, stabilization, and decision about your care going forward. I'd be happy to answer any questions about that.
Okay. Well, wait a second. Jeff, do you have anything else in your
Well,
presentation?
I just think that the other issue is, I think we'll have other opportunities to provide more details about what the center looks like, how it's being developed, see more particulars at a subsequent point in time.
And can you, this is a proposal, let's be clear. Can you tell us what the time frame is, who you have to seek approvals from, and how that's going to play out in the next few months?
Well, as I said at the initial point, if the timing was different, if the process of how the bankruptcy proceeded and the disposition of the property moved at a different pace, you say, well, why are you coming now? Why didn't you wait? And this was the opportunity. Given what we knew, we didn't think it was prudent to miss this opportunity to try to do something as we discussed. That's why we pursued that to do this at this time. I think what the next step in our process is we have to submit to the Department of Health what's called a certificate of need application, where we have to give more details about its operations, how it's developed, its costs. We're making close to a $100 million investment in renovating the O'Toole to provide these services. The Rudin family is also making a $10 million investment towards that as well. And the St. Vincent's Catholic Medical Center Board of Trustees is providing the facility. It's a partnership between the three organizations to provide this unique resource that we think is needed and we think it will be valued. And I'm extraordinarily proud to be associated with it. I know it's the timeline will be we have to go through that certificate of need approval process. It would take upwards of could be as done as quickly as 6 to 9 months. During that process, we'll be developing the architectural packages to start the renovations. If we can commence by the end of the year, we expect to be in the building by the end of 2013. As you know, that building has certain challenges. We have to maintain the architectural integrity of the building, the look of that building, that we'll go through all of those issues with landmark and historic use at a subsequent time. We'll do a more full presentation on the architectural solution within the building, not in the outside.
And just to be clear, again, this is a proposal. It's one that Community Board 2 and Community Board 4 just got today in terms of a press release. That's all we've basically seen at this point. Joe Hamilton, who's the chair of Community Board 2, could you tell us a little bit about the QLER process? Yes, just briefly, because there are a number of public reviews that have to be taken in terms of the Rudin application in the hospital. No, I actually don't know. Please, just okay.
Brad, could you clarify what you mean by suggested proposal?
It is a proposal because it hasn't been approved by anyone.
Well, the Rudins are buying the property.
It has to be approved by the bankruptcy court.
Well, we know that.
But no, I mean, and it certainly doesn't have the approval of any, as far as I know, anybody, elected official, State Department of Health, bankruptcy court, and certainly not Community Board 2 or Community Board 4. So from that standpoint, it's only a proposal. Joe, did you just want to talk about you, please? I'm sorry.
You know what, the entire St. Vincent site is located in the Greenwich Village Historic District. That means that anything that happens in that district to the exterior of any of those buildings has to go through the Landmarks Commission. That's always the first review process. For the hospital and for the site the East Campus, East 7th Avenue, and the Triangle site, that's all going to be going through a ULIT process. That's the Uniform Land Use Review Procedure, which means that the community board will have an opportunity to weigh in on the environmental impacts, on the social impacts, on the historic impacts. And then also, although we won't have a part of this, is that the hospital portion of this is also going to go through the State Department of Health, and that's what Jeff Crowd was just telling you about. So we've got a long way to go. A typical ULIT process can take well over a year. We're going to be asking all of the hard questions. We're going to be trying to find out more information, exactly what it is we're going to be getting, how it fits in with what we need. And also to be looking at the development that's going to be happening to the east. Is it going to be appropriate? Remember that when St. Vincent's was trying to build their 32-story building in the historic district, it's like the Rudins had already gone through for the residential project to the east of 7th Avenue, and they do have landmarks approvals, and that entire project came to the community board. We had a lot of concerns. There were tall buildings, there were buildings that were going to be torn down. We voiced all of those concerns to the Landmarks Commission. They listened to us, the Rudins listened. They came back with a much modified project,
And so that's going to be the starting point, provided this gets approved by the bankruptcy court. So we have a lot of work to do at Community Board 2. We hope to see you at all of our meetings. Any questions that you've got, we'll have lots and lots of opportunities for you to come and ask all of your questions, make all of your comments, and we'll be listening.
Thank you.
Under duress, Joe.
I appreciate it. Yes, you should give her a round of applause. She didn't want to do that. So at this point, I think it's appropriate that we open up the floor to the public. We want you to ask the hard questions, give us your comments. Sorry. Jeff said that there's a fact sheet in the back. This is the first fact sheet we've seen, so we're all very green and new to this issue. But we want to know more about this, and we want to hear what your initial impressions are. So here's what I suggest. Jeff, you go up to that table. And folks have comments or questions, if you could just line up here, and we'll start taking them. And we're going to limit you to 2 minutes, if that's okay. Is the mic working there? All right, Eileen, done. 2 minutes.
Jeff, I have to totally disagree with you about an emergency room without beds. I asked the question at the Little Red Schoolhouse back in May or June to a person from your hospital, do we need a hospital in the Lower West Side? His answer was yes, it's documented on YouTube. I've spoken to you and you said we needed a 200 to 300 bed hospital on the Lower West Side. You people are being played with. You're being played with. Plans. They are the same plans. I was on a committee at St. Vincent's. They are the same plans that Reuben had when they were partnering with St. Vincent's for a new hospital. The exact same plans. They're going to have a nice garden. They're going to have a new school. Where are all of the people that are going to be in those condos and the facilities going to get health care? The reason they won't give us the Coleman building for our new hospital is because the Coleman building is the only building they can tear down and fix and do whatever they want with because it's not landmarked. So don't listen to these politicians. They are playing games behind closed doors with your lives. Some of us won't even be alive in 2013. You won't even be alive. How many people in this room probably won't even be around to see this emergency room that they're talking about? The place on 20th Street is not certified nor accredited.
And not open during the day.
They're not open during the day. So you're not certified, you're not accredited. I looked it up. There's only 3 places in New York City, 2 in Staten Island and 1 in Brooklyn for pediatrics. Okay, if they're not accredited and they're not certified, you can have LPNs taking care of you. You can have physician's assistants taking care of you. There are no rules and regulations going on.
Money.
You should be outraged by this. Floats out. Okay, Christine Karim floated in and floated out. But one of her biggest donors is Reuben. Then they brought a real estate agent in to do the deal. CBL is her second biggest donor, okay? Keep these things in mind, folks. And when we have rallies, let's get out there. When you have zoning problems, let's get out there. Thank you.
Committee Board 2 and 4, we do not have an opinion on this, so bring it on, bring on the opinions. We want to hear what you think. Does anyone at the table, Deus, have any response to any of that in particular that you'd like to respond to at this point? There's a microphone if you do.
Well, no, my suggestion is, deference to people in the way, let everybody speak, and
Okay.
everybody just respond to some of the issues.
All right, 2 minutes, bring it on.
Sorry, I speak loud. My name is Glenn Bristow, and I'm just going to spend my time asking some stupid questions. What's going to happen to the displaced physicians in the O'Toole building? One of whom is my ophthalmologist, Marie Roland. What effort will the facility make to be in network for every insurance company that services New York City? I have not heard anybody define long-term, Madam Speaker. long term, and we had to be prepared for the long term. I would love to know a definition of long term. And also, I hope I'm wrong, but I suspect that there is a fatal flaw with the survey. Why? Because I heard that it's being disseminated by the elected officials, it's being disseminated here, you can fill it out online, you can fill it out on purpose, in person. Nowhere are you required to identify yourself. So what's to keep me from filling it out 20 times? And what's to keep the opposition from discounting the results because of that possibility?
Okay, Judy, do you want to respond to that?
Surveys like this are always confidential. You want to feel comfortable and free in answering questions.
But the opposition is going to come back and
Let her
say,
finish.
20 people could.
Yeah.
Here, that happens. That's not the goal of this. The goal of this is to reach as many people as possible. One time. Again, the paper survey, we hope is going to be, there's going to be surveyors from the community asking questions and doing it. I fought very hard to get a thing that said where you fill this out on the survey form for that reason, so that you could get a sense and gauge where people
And
are.
is there a deadline?
Thank you. The task force will start.
Yeah.
I don't know whether that's been decided.
Diana, can you talk about how,
We are not paid by any politician doing the survey. We'll be doing all the going out. But I'm just saying, so that she mentioned it, just to let you know, there's no money coming from any elected official to my organization.
That's not my point.
Just, yeah.
and Diana, could you just describe like how we avoid the issue of duplication?
Sure. I think that's a wonderful question, and actually something that the online version that Hunter has been helping to develop is very concerned about. So there are 3 different ways that it's going to be disseminated, and with our partnership with the community-based organizations, to the extent that they provide us with their email list, we're sending it out through SurveyMonkey, and in doing so, it will prevent duplicate responses. It will only go to an email address, and even if the individual starts it at their home computer and finishes it at their work computer, the link that they get through the email is a unique link, and it prevents duplicate responses. The link that individuals can fill out the survey through websites, like the community board websites and other organizations, unfortunately won't have that 100% protection, but the questions in the survey will allow us to look for duplicate responses by the characteristics that certain people enter. We can look for, including zip code and a variety of other personal characteristics, we can unduplicate responses, not 100%, but probably upwards of 90%. What's handed out, the paper version, is something that we're going to be pretty much instructing and guiding our community partners in trying to ensure that duplicates are filled out, but that's where we have the least amount of control. If anything, we think that the duplication could be from individuals who are very much inclined to want a hospital. We're not so sure it'll be the other way around. But we have measures in place that will probably minimize that.
Thank you very much, Diana. And Jeff, do you want to talk about the access that was raised, the access issue?
Yeah, just the urgent care center is located adjacent to the Village Care Community Health Center. So what we had done is the hours that Village Care is closed, this center opens. So there's a 24-hour health presence here. So this will not only serve Village Care's patients, it'll serve everybody in the community, including physician offices that are closed or other neighboring community health centers. On Monday, Tuesday, Thursday, and Friday, the center will open when Village Care closes at 7 p.m. and it will close at 8 a.m. the next morning when Village Care opens. On Wednesday night, Village Care stays open till 8 p.m., at which time we will open and stay in operation through the night till 8 a.m. On Saturday, which I was just copying the numbers, we will be in operation essentially from 5 p.m. to 12 a.m. and again to 8 a.m. and 24 hours on Sunday. So all the time the Village Care is closed, we will be open. And you will, what we're going to do is we are going to get out a brochure that explains the center, the types of things, the staffing, addressing all the questions that were asked. And we'll get out a flyer, and you'll start seeing this advertised and promoted in the community, so you're aware of it, and the hours will be visually posted.
She asked about where doctors would go with it.
Yeah. Andy, do you want to just take the training of the, Andy? Do you want to take the training of the physicians? That is staffing? Oh, I'm sorry.
Where
I think
the doctors
Oh,
that
I'm
were
sorry.
formerly in the hospital.
I misunderstood the question. I thought it was about.
The doctors for the 3,500 patients with HIV that get kicked out in 50 days, where they go.
Right, that's it.
Well, look, I think there are a lot of details that have to be worked out. That's why. I honestly, in all fairness, we had been working on the plans. We had just been focusing right now on the emergency. There's other things that have to be done, and I think a lot of the other details we do have to work out.
Which is why we're doing the health
I mean, that's part
assessment.
of why we're doing it.
Okay, and then I think, Lynn, did you have a question about insurance?
Yeah.
What about insurance,
That you
Jeff?
qualify to be in network for every insurance
Oh, yes,
company.
anybody that shows up in the emergency room, in the emergency department, regardless of insurance, is accepted, just as you would in any other emergency room in New
No, I'm
York
not
City.
talking about that. That's fine, but do I have to pay out of pocket? I want to know if the facility is going to be in network
Oh, yeah, the facility's in network, yes.
for every
All
insurance
except
company.
all the major insurances in network that are available commonly in any hospital in New York.
What about
You'll-
uninsured?
Can we ask these questions?
Yes, you can answer this question.
Would you want me to answer one by one, or do you want to?
No. Okay, that's fine, and then we'll go to the next question or statement, and then we'll see if
Brad,
the committees have a response.
Yeah, no, I actually got one thing. I think one suggestion I think that we need to put together is a working group that has community members involved, board members involved, so we don't think that there's any more backdoor deals being made anymore, and we are part of what goes on in the future.
That's a good point. Yes, sir. Can you just introduce yourself and ask your question 2 minutes?
Reason why Justin Pontenacotta. My concern is why should we have anything to do with people from St. Vincent's board when they did that quite 2 times?
Okay. Thank you very much. Next. Just state your name.
Karen Smith, CPHS. I have 3 questions. One is the sliding fee scale for the uninsured. What is it going to be? My understanding is that LIJ is not going to bid on this, so what is it going to be for this new institution? 2, I really don't get why we're even considering this when we just put out this questionnaire and it hasn't been done. I'm totally at loss. It seems to me as if you have something already that you'll tweak, but there's this questionnaire that is supposed to get what the real needs of the community are. And then one more point, which is in your facts. I'm a retired New York State Supreme Court judge, recently retired in September. And I was a judge who made a decision in a case involving the development of, in Red Hook, of IKEA. And in the Gurlitt process, one of the things they said is that this will employ X number of permanent workers, as you would have in your facts, employ nearly 400 permanent workers. I had no reason to doubt it. I passed it because they followed all of the laws, and later on, follow-up, they did not employ anybody almost from the community. So what assurances are there that you're going to actually employ people from the community? Because I've never seen it yet as a judge or otherwise. Thank you.
Thank you very much. All the questions, you want to take them now?
You tell me?
Yes.
You asked a question about the sliding fee scale, and that was in respect to the emergency department. Essentially, North Shore... For the uninsured. North Shore LIJ, without a doubt, has the most liberal policy with respect to providing financial assistance for those people who can't afford it. You always hear it expressed in terms of people living at the federal poverty limit, which is about, say, $17,000 for a family of 4. We acknowledge the cost of what it takes to live in the New York metropolitan area, the cost of housing, and the financial difficulties a lot of our patients have been experiencing, particularly in the last few years. So we adjust our fees based on your ability. So sometimes you'll see normatively in New York State that they'll go to 4 times the poverty level, for a family of 50, 60,000. We don't believe that's enough. We adjusted for a family of 4 up to $107,000. We will provide that. And it's one of the things we're very, very proud of this policy. It's actually a national and state model for financial assistance.
Okay, and I think there were a couple of other questions.
Yeah, I would just like to respond. I have done some research on this and done a chart of safety net hospitals in New York City. Both Lenox Hill and Long Island Jewish are not on that list. As a matter of fact, Lenox Hill has one of the worst records in terms of taking care of people who are uninsured and are on Medicaid. The other one worse is NYU Medical Center in New York City. So I think, we have to be concerned about that.
I think Judy...
And anybody who wants this chart, I have a copy.
Yeah, thank you, Judy.
I can just a comment.
Yeah.
I think Judy may in fact be correct about Lenox Hill, but we just got in there, and their policy will be identical to the one I just described.
Thanks, Jeff. I know you sent me an email with some questions specifically about what kind of responses that this center might be able to manage. Do you want to ask that question in addition to whatever else that we do? I was basically saying that you have some questions about the kinds of scenarios that may or may not be managed by this new proposed center.
What do we want? Hospital! What do we want? Hospital! When do we want it? Now! I did send you and others emails with questions. Those weren't my questions. I obviously think the community is outraged that this is being heralded as a historic plan, and my inbox filled up today with angry emails asking questions that I forwarded on, and others like, how is this different from the urgent care plan that they proposed back in April when they closed our hospital, right? I guess, so obviously there's a serious concern here in the community. At the same time, I guess I want to try to be optimistic and say that there's good news and bad news. And the bad news is all of what have as of yet been rhetorical questions from the community. What happens if a child eats some peanuts at PS3 and goes into anaphylactic shock? What happens if a parent in Penn South starts to feel dizzy and has a stroke? What happens if a friend or family member has a heart attack? What happens if someone is hit in a horrible accident on 7th Avenue and needs immediate surgery to save their lives? Is this facility a facility that will do any of this? No. And shouldn't we have the right to have those types of services in our community? Yes. It's literally life and death, and we literally cannot live without these services. Now then, that's the bad news. This is apples and oranges to what we lost, what we need, and what I think we're legally entitled to as a community. Do you agree with me? Okay, here's the good news. We are reasonable people, and I address this to LIJ and to the Rudin Development Corporation, which is very well represented this evening. We are reasonable people, but we are in a health crisis. So excuse our desperation when we say we don't have 2 years for an urgent care center or a comprehensive care center or anything other than what? When do we want it? Okay, April 30th, we have a big rally. Here's the good news. The reason people are here today, the reason LIJ and the Rudins are even talking about this is because of the pressure and much of the work that you in this room have done, so thank you for that. But now is a defining moment. I look to what our elected officials are going to do. They are our public servants. This is their golden moment. We need them to tell the Rudins, to tell LIJ, thank you very much. And we need you to go back to the drawing board and come back with a better plan that includes a hospital. And I can can only talk about this, I mean, Dunn can only talk about this, we can only talk about this if you guys turn out en masse on April 30th to let them know that we are not going to stop until we have a hospital. But this is doable. If they're willing to spend $100 million and St. Vincent's is giving them the property, first of all, I thought St. Vincent's was dissolved because it's in bankruptcy court. Every time we asked for something, that was the answer we got. If they can give the property for an urgent care center, a comprehensive care center, they can give the property for a hospital, right? So it's doable. Well, we are reasonable people. Please, the Rudin Development Corp we've reached out to over and over again. Sit down with the community. We will work out a plan. If we can do this, we can get a hospital back at the site of St. Vincent. Are you with me?
Thank you so much. So back to the next questions. If a child eats peanuts given by a friend at PS3 and goes into anaphylactic shock.
Well, let's ask the doctor to answer that.
Okay.
Sam?
Sure. Yeah, I can answer
Yeah.
that question.
Okay. A kid eats peanuts, goes into anaphylactic shock. Can this center handle it?
Yes, of course.
How?
The same way you would handle it in any emergency center.
Okay. A family member feels chest pains and suffers a sudden heart attack. Can you handle it?
Yes, you can be seen as a patient, you can be evaluated, you can determine what needs to be done, you will be cared for if you have a heart attack,
How fast will you be able to deliver clot-busting drugs to that dying patient in that urgent care center when you need that? Should be the
First of all, it's not an urgent care center.
Okay.
It's not an urgent care center, it's an emergency department. I understand you're uninterested in hearing that, but that's a fact.
That's not how emergency
And the answer to your question is 30 minutes as prescribed by the American College of Cardiology.
Right, but that's 30 minutes there. You can't deliver the drug.
That's not true. The drugs will be available on site.
Okay.
Thrombolytic therapy, if necessary, will be available on site.
This is where you have symptoms, you go to 2 doctors, you get 2 opinions. No, I'm gonna have this, we can go on and discuss everything, everyone. You can talk, I just want to explain something, and we will have to vet this out. I'm saying we're gonna subject to this, but I don't think it's productive. Right now, you're gonna go this, go back and forth. We'll go through this. But what I'm really concerned is I want people, to listen. I want people maybe to be willing to listen. I know what happened is terrible. There is no denying it, the involvement that we have in the data. What we understand what's going on. If we had a chance to explain, instead of talking in sound bites, what's happening, where people are going after this had happened, how the care has changed, how your doctors have moved to other locations, to different hospitals where they're taking patients. We have a lot of information that if we were given the opportunity to share that with you and explain it, you'd understand and you'd be able to make a little more informed decision. Now, I'm not saying I don't expect for everybody to come on the same night that this is announced, that everybody's going to say, wonderful, and we're going to walk out of here. There's a lot of information that has to be shared, and at the end of it, you may absolutely not change your opinion one iota. But I think I'm not trying to stop a conversation. I want to hear the questions and I want to respond. But to go back and forth, we're going to go through a litany.
Okay, that's fine. You totally understand. Let me just finish this question. Somebody has, begins to feel dizzy, has a stroke. I know, doctor, can the center address it?
Yes, you can be addressed it.
Okay, and then somebody is in a horrible traffic accident. What do you do about that?
Somebody's in a horrible traffic accident and they require a level 1 trauma center, they would not be brought to this emergency.
Okay. Absolutely not. So, okay, we're just getting the answers here. And then finally, what if there's I think the question, human-made or natural disaster, like do you play a role in that?
There would be an emergency preparedness plan at this site, along with all the other hospitals in the community, to address the needs as patients present.
Okay, so we got the questions answered. You can like them or not, but now let's hear from the next person, and thank you very much.
My name is Jane. This comprehensive care center that LIJ is proposing sounds very much like the plan that Continuum was proposing. proposing, I believe, last January of 2010, and the community came out loud and strong, including all of the elected officials, and said, absolutely not. This is not sufficient. We need a hospital, we need a level 1 trauma center at this location. The nearest trauma center is Bellevue. My life was saved in that trauma center on Sunday night of a Memorial Day weekend when I was in septic shock. There was no time to get across town to Bellevue. The whole Lower West Side is facing this issue. This is not even remotely good news to us.
I think this is what we asked Joe Hamilton to discuss earlier. That's why the ULA process is so important in this. This is an RFP proposal. So during the community forums and the ULA process, we have the ability to speak our minds and what we want in the proposal. So if there's changes that need to be made and we need a full-scale hospital, and that's what we in the community definitely want, then we need to come out in these community forums before it does get approved from Scott Stringer's office, Christine Quinn's office. It's our saying that's going to make sense. If we don't approve of it, then we're entitled to go to city council hearings, we're entitled to go to whatever hearing it is to stop this proposal.
Judy had an next question. Judy.
Yeah, I just, it's my understanding, and you can correct me if I'm wrong, but the only places where this type of arrangement has been done, that is an emergency room that's freestanding, maybe with some holding beds, are in rural, isolated areas where there's nothing else.
Correct.
Doing it in a city is like second best or whatever and doesn't work from my perspective. If there is examples in a city where it works, then I'd like to know about it, but I don't think there is. And we're not a rural area.
Just really quickly, 2 points of information to echo what Judy and Miguel said. First of all, unfortunately, there is precedent that the bankruptcy court on April 7th could override that important ULA process. So we have to be very vigilant and check out what's going on there and also appeal to that process, because unfortunately they could overturn our ULA process. And the second thing is I echo what Judy's saying, which is we don't necessarily think it's a good idea or a good thing that this is the only type of freestanding system anywhere in the city. That's being heralded as a positive thing. Actually, that raises red flags for us.
Thank you.
Thanks.
Hi, I'm Yvette Stark. I live on West 11th Street. I've been in front of this committee before. I don't want to reiterate that we need a full-service emergency trauma one hospital with beds, because that's what we need. I'm very curious to know if the needs assessment has been done on the east side. Why on the west side? Is there less of a population on the west side? Is there more on the east side that they should have all the hospitals? Yes. And that the lower west side should not have all the hospitals? Maybe I'm missing something here. Is there more development over there, or more development going on downtown by the financial area and now by Trinity and other places here in the city? So, I mean, I recognize that everybody's working hard, and I'm really grateful to the community boards and to everyone on the panel for creating all these questionnaires for a needs assessment, but it just seems ridiculous. Because there is a population here, there was a hospital for 168 years. Further, the fact that all of a sudden we're hearing that St. Vincent's is donating a building is very distressful to me. GE Capital, when I had witnessed the bankruptcy court Freedom of Information Act down in the court system, all that brouhaha that went down in the court system, there's a $320 million note to GE Capital, and 3 weeks before the hospital closed, there was an $85 million note that was owed by St. Vincent's to GE Capital. All of a sudden, there was a $300 million offer made from the Rudens, who are a great family, historic in New York, builders of New York, and wonderful people. But now all of a sudden there's a $260 million offer. So my question is for C.B. Richard Ellis and for the Rudens, is GE Capital taking this loss? Well, that's really wonderful. I'm really grateful for all the stockholders who are taking that loss in that big company. So, and I'm also interested in how we're preserving the actual infrastructure of this hospital, because
there are 4 sub-levels that you don't want to go down further. It's there, the infrastructure is there for a hospital. That is where the hospital should be. Also, there was 198,000 square feet allowed for development on the triangle, only under a distressful situation, but it's in bankruptcy court, so that development right doesn't exist anymore. Sorry.
Thank you, Annette. Anyone want to respond? Dr. Trump.
So, unlike Eileen and some of the other speakers, I don't speak so well when I'm angry, and I am enraged. It's really hard for me to speak, frankly. So I'm just going to throw a few things at it, okay? First of all, I think Deanna said something about elected officials. Anyone see the elected officials here?
No.
I saw Chris Quinn come in for about 90 seconds. Flanked by people. I didn't say representative. I said elected officials. Representatives are good, they're nice, I'm glad you work hard, but I'd like to see some elected officials to hear how we feel and what we're saying. Okay, so I think somebody, I think it was Brad, said this is just a proposal. I want to know, if it's just a proposal, why the HIV clinic I work in and the other one that's there, that takes care of 3,500 HIV patients, the largest population of HIV patients in the state, if not the country, has been given a 50-day notice to get out of the building. I want to understand that. 50 days, 3,500 patients. We've been looking for space. But it's not so easy to find, as most of you in New York know. Okay? So that's number one. I'd like to know what the other speaker was asking. What happened to all the doctors and their patients who are on the upper floors? Not that it's very nice up there. There's rats up there, the elevators don't work and everything else. But what happens to those doctors? Okay? All right, I'll just finish with this. We've taken a lot of flack for using the term landlocked. Doesn't exist, it's not a real word. I contend this is not an emergency department. And Jeff, you and the doctor and everyone else can use that term as much as you want. It's a lie. It is not an emergency department. I respectfully suggest that you survey 100 doctors, let them be North Shore doctors, and ask them if they thought they were having a heart attack or a stroke, would they choose to go there or to a hospital that has cath labs and neurosurgeons and stroke teams and everything else? That is a bullshit lie. I don't understand why this needs assessment is going on. I didn't understand it from day one. Like Judy, I agreed to participate. I regret that. I have canceled days of patient care to participate. And yet, Jeff Kraut stood in the last meeting and said, the data says we need a hospital of 200 or 300 beds, no question about it. And here we are with this dumbass proposal. It makes no sense to me.
Any response to any of those comments?
I want the question answered about the eviction of the AIDS program.
Does anyone have any information about that?
Yeah, behind the closed doors with the politicians.
Yeah.
That's the answer.
Maybe it was the board of directors. All right. Any other comments or questions? Yes, please.
I'm Wendy Fiester. I work for Assembly Member Dick Godfrey. A couple of people asked where the elected officials were and what do they think? Well, I can speak for Assembly Member Godfrey, and I'm pretty sure I can speak for the other two state representatives, which is that they're probably on their way back from Albany. Today they were in Albany, and that's part of their job. And this was scheduled as soon as it could be scheduled. Unfortunately, they could not be here. Chris Quinn, I imagine, was here as long as she could be. She's a speaker, she's got a big district, she had a lot of other places to be as well. But I shouldn't speak for somebody I don't vote for. But I am going to point you all to a piece of paper that I hope you picked up tonight. It's a letter that was signed by Kristen Quinn, the speaker, Scott Stringer, the Hatboro president, Jerry Abbott, representative, Tom Wayne, our senator, and Dick Godfrey. The third paragraph. Since the closure, we have repeatedly made clear that our first priority for the neighborhood is to obtain a full-service hospital and emergency room to replace St. Vincent's. Is that not clear? But where are
The first and best replacement remains a full acute care hospital and a 24-hour emergency room. Here's your opportunity. That is where we stand on paper. We are working with you, members of the community, on this and trying to put together an assessment to understand what we can get, what is needed. I urge you to take some of your energy and put it into this community survey to help better inform the decisions that are going to be made. Just sitting here and trying to put down a facility that's coming into the community that will be saving lives where we don't have an emergency facility now, I think is really not is not a good use of your time to just be saying no to it. I would be really sad to see this, to see LIJ.
Where do you live? That's
I live, it doesn't matter. I want to go to the nearest facility that can take care of me, just like you would.
Upper West Side.
One word, Skype. Where's
Thanks
the
very much,
Skype?
Wendy. Any comments? Next speaker, thank you.
Wait, I have something.
No,
The meeting was organized by the election.
Doctor, please speak.
Thank you for coming.
Hello, my name is Liz, and I'm new to this community. I just moved in August, and so I have no answers for you. But I'm here tonight because I've been so impressed with the gravity and, quite frankly, the confusion of this issue. And I wanted to offer something.
Come to the right place.
I'm a community-based theater artist, and I am getting a project started called the St. Vincent's Theater Project. And this is a space to explore these questions, to talk about the loss of the hospital that has been in the community for 160 years. I'm really interested in that, and I would love to create a space that is not quite so charged, to talk about these issues and how to move forward and to share, and to possibly create some kind of performance that can be shared with the wider community. So that's why I'm here. I have some flyers. I'll be in the back, and I'd love to talk to all of you. Thanks so much.
Thank you very much. I was trying to get a clip to follow that, but it's really not one. My favorite. Yes, next speaker.
Hi, my name is Alexander Meadows. I'm a resident of Community Board 2. I'm also a member of the Community Board. And I was going to come up here and ask a question until Jeff said something that I found very insulting along this lady. And you said to us that if we would sit and listen long enough, we would make the informed decision. Well, I have challenged you to sit and listen, and you will make a more informed decision. But you speak to us as though we're children, and what you have on paper is as good as a campaign promise if they don't follow through and it doesn't become So now for my question, this sits on two one-way streets. How will the ambulances be parked there? How many are you required to have? How many will you have at all times? That's my question.
Okay, thank you.
I think what we're going to do is, again, we'll show this in a little more detail when we actually show how the ambulance traffic, the ambulance traffic is going to come off of 16th Street. There'll be an ambulance station there at all times. If one ambulance has to leave, another one will be pulled out of our fleet and put in place there as well. So the ambulance traffic will be on the side of 16th Street. Oh, I'm sorry, 12, where are 16th?
12. Okay. Next. Thank you. Just stay there. 2 minutes.
Jonathan Salcon, I'm with the Chelsea Reform Democratic Club. I had a question similar to his because a neighbor of mine, she's a Republican actually, and she called me one morning this past fall and said that she had just called an emergency and that she felt like she was going to die. So I rushed over there and we waited, and she kind of passed out a couple times, and I tried to revive her, and the ambulance finally came in 35 minutes. And the fire, they said they got lost from Lenox Hill during the day. And the fire, they needed, it took them an hour to get out of the park. Literally an hour. And it took another half an hour to get across town. So it was about 2 hours before she actually got to the hospital. And the ambulance guys said that they had to wait for the fire department to carry her out. The fire department has a separate emergency vehicle with ambulance. My question is, are you guys going to be able to handle what St. Vincent's used to be able to handle as far as the volume of emergencies?
I think, as I said before, the two issues here. One is EMS, FDNY, ambulance. We're not running that. But with respect to the facility, we're going to have twice the space that St. Vincent's had. We'll be able to accommodate, with respect to the needs of the immediate community, we think we can accommodate between 25 and 30,000 visits.
I just want to add, sorry to hear. Yes, next speaker. Question or statement, 2 minutes.
My name is Steve Gould, and I've lived in the community 45 years. And I just want to point out for all of us to remember a couple of things. Number one, Assemblymember Godfrey is chair of the Health Committee up there, and he certainly could have, when he knew that Richard Daines was going to make that ruling that knocked out Mount Sinai, he could have asked Governor Patterson to have Daines recuse himself because of that, because at that time Continuum was in. But I also want to point out something. Now I work like hell because I work with senior citizens and they needed the Hudson Street post office to remain open. If all of our elected officials would have spent as much time and energy on St. Vincent's, it never would have happened in the first place.
Thank you for that. Next comment or question?
Hello, my name is Judy Richheimer. I live on West 23rd Street. It's incontrovertible that we need a hospital, a full-scale hospital on the west side. I would almost. It sounds like there is a slight improvement in this plan over the one that was presented last year, because last spring the plan just absolutely precluded heart and stroke presenters. So you're claiming now that you can handle this, but my concern is, and I actually would like to get Wendy's attention, it would be okay if we had this half loaf, if that did not shut down the really, immediately following getting a full-scale hospital. But it sounds to me that once accepting this plan, for whatever you want to call this, that it would preclude getting a hospital. So if Wendy Pastor is listening, or if anybody else would like to respond to a question having to do with sequencing, my guess is they cannot be sequencing. And then I would like to reiterate a question that was asked before and not answered, which is, would you gentlemen or any of the other doctors that are represented here want to go to such a facility over, I'm sure you'd want to go to this facility rather than nowhere medical, but would you prefer to go to a medical center called a hospital versus a medical center called a whatever we're calling it now, this new entity? So 2 questions.
Any response to those? I guess the first question was,
Having to do with sequencing.
yes. Will this stop us from getting a full-service hospital? The speaker said tonight that it won't. But other people may have ideas for strategy. Miguel, do you have any sense of that? Okay. The second question about the quality of emergency care. Jeff, can you speak to that?
For cardiacs.
I mean, the issue is this. If I have a sudden and serious onset of symptoms, I want to be cared for by the most capable person as quickly as possible. And if that's in an ambulance, so be it, in the middle of the street. And if they're not an ambulance and I'm able to walk into this facility, I would say, yes, I would be fine about that.
But wouldn't the gold standard be a full-scale hospital?
I can't debate the relative merits of a full-scale hospital has, yes, a lot of other things. Would you, I said at the beginning, if you take a look at most of the community hospitals here, most of the people in the city, and even the people in this community, they have access to New York Downtown Hospital. Would you make that same judgment?
That they have access to
That they shouldn't go to a hospital if they have a sudden serious onset of symptoms? I'm telling you that this facility will have the same capability as that hospital.
Okay, thank you very much, Joe. Next. Thank you, just a few minutes.
You'd have to say to the people.
Hi, my name is Barbara Luther. I worked 35 years at St. Vincent's Hospital, and I've spent some time in O'Toole building. The point I would like to make are two. One, a building is a building is a building. There's a moral issue about not using the 7th Avenue and 12th Street building. That's where our hospital was. It could still be there, and landmarks has nothing to do with morals. It's what we know is right in your heart and in your gut. It's wrong, it's all about money. Now, I would like to say you could make a deal like this and come up with this creative, well, keep going, because you got to get that building and put our hospital back there. Now, a matter of principle again. I understood Long Island Jewish was not able to put the, I mix your names up, to put the emergency room, you could not go into the emergency room because the hospital would not allow birth control to be practiced. And now we're going to move to O'Toole? Thank you.
I just want to echo what she's saying. You know, the concern, we're all hearing it, and I hope they're hearing it, because to be honest with you, I'm even a bit concerned, because North Shore opened the urgent care center, and nobody even knew it was open. So there's worry in the community, because I heard from a news station that North Shore opened 2 days ago. I shouldn't be hearing from a news station about an urgent care center opening 3 or 4 blocks from here. You know, this hospital closed. We do have powerful elected officials. We're hoping they keep to their commitment to make sure we do get a hospital. And it's scary because we are afraid that it's not being used as a land use issue to make a developer profit from what we lost as a hospital. So I urge everyone to continue to fight, because I'm going to continue to fight. I'm not going to lay down and die until we get a full-scale hospital there.
All right, thanks, Miguel. Well said.
Hello, Elizabeth Adam, 12th Street Block Association and Coalition for New Village Hospital. Not quite 5 years ago, I picked up the phone and called for an ambulance. I called 911 because my heart stopped. While the EMT were there, they got me restarted, they got me into St. Vincent's where they installed a stent in my heart. Will you be able to perform that kind of surgery in your new facility?
No, as we said, there is certain things that we can't do. Now, interventional cardiology, the placing of a stent, the ambulance would never have taken you to this facility because they know we do not have that capability. They would have taken you to the hospital that, once you're stabilized, they would take you to the hospital that's closest that has that capability.
St. Vincent's was 3 minutes from my home.
Correct.
They came in 3 minutes, I was there, and I was surgery within the hour.
Yeah, but you asked the question, would you be able to do that there? The answer is no.
So no. So I would be dead. Quite possibly be dead. The other thing is, I wonder how long you have been working on this project, because it makes me a little suspicious that first we had the urgent care center, now we have this project. How long has this deal been going on?
Well, I wouldn't say, I could just talk to you about the data. we've been looking to do something like this from the first day we came here. It's one of the first meetings of our community health assessment.
When you say you went from the first day,
We started the community health assessment, I guess in September, October is when we started really looking at the information and the data. We had done it previously for the urgent care center. So, but we had been looking at these issues and constantly had come up in a lot of the conversations we've had with the community groups.
since the closure of the hospital, you started thinking and...
Well, no, as far as that site, no. We were looking conceptually for a facility that would accommodate this, yes, but this site made that opportunity, a reality. I mean,
Okay, so, one more. Perfect timing. No problem. 2 minutes.
Okay. Question one, and actually this is more of a statement. I'm Roberta Gell. I've been in the neighborhood for 33 years. You may remember me from the Barney's fight, which was a great lesson in civics. All of those discussions about Barney's, everybody was giving testimony at the Board of Estimate, and the deal was being made in the back room. When your elected officials are missing in action, there's a plane from Albany to New York. It takes less than an hour. If something of this magnitude is not important enough for them to be here in person, that's the message. Now listen, you've got to understand how this works. It's all about money. And the fact that they're not here, to tell you the truth, I started looking at my clock and I thought, I'm going to miss that show I like at 8 o'clock. No, it's not American Idol. It's the one with the nerds. So at any rate, I thought I'm going to miss that. And then I thought I want to leave. But one thing I want to say is, this is political and it's based on money. And you know as well as I do, he talked about procedures that can be performed. But who is going to be performing those procedures? If you have a cardiology department in your hospital and you need a stent and you're in the emergency room, you can pick the best cardiologist. Who's going to be staffing this? You cannot compare an emergency room to a full-service hospital because your personnel is totally different. You want someone who is an emergency room generalist. Now, these are great guys. I mean, when I can't breathe and I'm having an asthma attack, I love them. But if I needed something more, I want the top pulmonary specialist in the pulmonary department, not a generalist. And that's what you get in the hospital. So we're not talking about the same thing. When we had the snowstorm, and I'm thinking to myself, I was having a little trouble breathing. I'm thinking, gee, there's like a lot of snow here, and I'm having trouble breathing. And I thought about it, and the first thought I had was St. Vincent's. And the second thought I had is, you are screwed. You better hope that Vincent works, because if it doesn't, how long is it going to take you to get across town in the middle of a snowstorm? And if you're an 85-year-old lady, luckily I could have walked, because I'm a man, somewhat decent shape, not according to my doctor, but I could have walked. So we have those issues. These are real issues, but I'm going to walk out of here with one major concern. I love Tom Green. I have the greatest respect for Dick Godfrey, but the fact that they are not here tonight is, as far as I'm concerned, inexcusable.
Those issues in our needs assessment. Now, I know some of you think it's not worth doing, but I would urge you, sorry George, I disagree. This needs to be on paper. We need to have a record of all of these concerns across our entire neighborhoods. For Dick Godfrey, for elected officials. Judy, tell us why it's important. Judy, come here.
Judy.
Tell us why it's important.
Usually defend elected officials, but thank God they're in Albany. We have a governor who's actually worse than the governor of Wisconsin in a lot of ways, and they before about the Medicaid design thing, it's a disaster, it's disgusting. The deals that were made are outrageous. I want my elected officials, and both of them are my elected officials, to be up in Albany taking care of business.
But this is the age of Skype. This is the age of talking into the computer.
Please.
There you got the monitor right there.
So that's one thing. The other thing is that I just find it astounding, and I wanted to ask this question, that it's going to cost $100 million to set up an emergency room. I don't believe that it's going to cost that much, and I want to know what else they're going to be doing in that building and how that money is going to be spent. And I also want to know where that money is coming from and how it gets paid back. Thank you.
Any comments about how much it will cost and,
Well,
we'll be
you know, I
reviewing
think
that.
we're going to go through the details architecturally. We'll explain why it costs that much because of the, remember, it's not just the emergency room, it's 169,000 feet being redeveloped within that space, plus the, you know, so there's a lot of other things. We can explain why it will take that much. You have to raise ceilings and put in new mechanical. We'll go through that when we have a more detailed discussion about the facility plans.
Okay, and you know, again, on the needs assessment, I know there's a lot of skepticism about it, but let's not be cynical about it. Really, we're all volunteers on the community board, and a number of us are volunteering our services pro bono to organize the needs assessment. We really believe that our community has a lot of important information to tell our elected officials, to tell our State Department of Health. What we've been talking about for the last year hasn't been memorialized anywhere, except thankfully for George and the local paper, The Villager. But elsewhere, it's nowhere to be seen. If we don't get that information collated, collected, and distributed to the people who can make these decisions, then we are completely out of the conversation. So I would urge you, from Community Board 2 and Community Board 4, to take the needs assessment seriously. And please work with us on that. Now, we have one final speaker. I hope you don't just negate everything I said. Okay.
Carol Yost, Coalition for New Village Hospital, and the Hands Off St. Vincent's Action Group. My question is this: people keep talking about money. I want to know exactly who is making money, how much, and from whom, and when, and for how long. Exactly why are people pushing this particular project instead of what everybody obviously wants, or 99% of the people want? Where is the money coming from, how much, and who's getting it?
Where did it go?
Okay, and that I think is a question that we will continue to ask in the meetings that we're going to be having moving forward. This is just the first preliminary step in examining this proposal. I think it's still a proposal, I hope. And we've heard everyone loud and clearly what your concerns are, what your questions are. We've gotten some answers, but not all of them. But we on the community boards 2 and 4 and for the Needs Assessment Steering Committee are going to try to do yourself justice and continue to ask these questions and creating a forum to do so. So thank you very much. We'll see you next meeting.
To me, this is utterly deceitful, shoddy attempt to
deceive the people in the community who live down here and ignore all of the things we've been saying. And to call this an emergency room, it's like me calling my car an ambulance. It's utterly absurd. What was that?
You called it out as a lie during the meeting?
It's a typical deceptive use of language to try to get people to believe something that's not true. It is not an emergency room, at least not by any law or regulation in this state and any clinical practice that I've been involved in for 35 years.
So for those who don't know, doctor, what is the definition of an emergency room in your opinion?
It's a facility that is part of a full-service hospital where there's the backup to take care of all medical and surgical problems as they arise on an emergent basis, particularly those that are totally time critical, like strokes, heart attacks, perforated organs, stab wounds, gunshot wounds, overdoses, etc.
What did you think of this meeting?
I actually thought the meeting was, initially I was totally disgusted with it, but I kind of got more into questioning. I wish there were 5,000 people here, and I think it's insulting that not a single elected official was here for the meeting.
And what did you think when you heard the news this morning, the Rudin Company?
I wasn't surprised at all. This deal has been in the making. It was all a question of when they'd finally announce it. I think it's been a done deal for 6 months or more.
What do you think is the appropriate response from the community at this time?
Appropriate response to the community?
Yeah.
I think we keep doing things like tonight, and we get out in the streets and fight it, and talk to our elected officials and fight it, and do everything possible.
Anything else you want to add?
No, I'm very discouraged. I think this is just so deceitful and deceptive and virtually an immoral process. Very discouraged.
The most valuable thing we have right now is the community. The community. It's always been the community. I don't know how we get the politicians to listen to the community because the politicians don't even show up at these things. The politicians haven't shown up for a year now. They haven't been at any rallies. They send their underlings to come. They don't show up at all. So the value of tonight, it is very interesting comments made from the people of the community that were here, which were a lot of different faces than I've seen at other rallies and other meetings. It's the community. They have to come out. The nurses have to come out, the doctors have to come out, especially when people are making comments about the care that you would get in an emergency room versus the care in a full-service hospital. It's like, I think David said, that's like calling my car an ambulance, which is a really kind of interesting concept. It's still the community, so I ask the community, please don't give up on this fight because it has to pass many state agencies before it finally gets done. I know it's been going on behind closed doors. I knew about this last week. When I went to bankruptcy court, I was told about it. And now we have electeds standing up here saying this is the first time they heard about it was this afternoon. Okay? We're being lied to on every level, and we need to get to the truth. The community is the only one that can demand the truth, and please don't give up, because I'm not giving up.
I think that the proposal that came out today is, in simplest terms, real estate interests and financial interests deciding healthcare policy. And that can't be what happens for our community. And that's the bad news. The good news is that today the community was very clear. We've been saying the same thing we've been saying for a year. An urgent care center, a comprehensive care center, whatever you want to call it, is not a hospital. And I think people made very eloquent, very sophisticated, and very intelligent reasons for why we need a hospital. The quality of care, the type of people who are going to be offering that care, the quality and the training of those people, the level of care, the types of care, you know, it's apples and oranges. And as I said, the community has an absolute right to health care and to public safety, and we're not going to stop until we get a hospital back at the site of St. Vincent's. The other thing I want to point out is that the good news of this is that the Rudin Development Corporation and Long Island Jewish Hospital are talking about health care. That's wonderful, and what they told us was they're willing to spend in their money $110 million aggregate to do that. They've also mentioned that St. Vincent's, which I thought was already a dissolved entity. I'm not sure how they're at play in this, but St. Vincent's Hospital is willing to donate the land, which is upwards of worth hundreds of millions of dollars as well. Now, we heard last month from an engineer from ARUP who said that the general cost of restoring a hospital at the Coleman building would be maybe $200, maybe $300 million at the top. That's the same amount of money that we're talking about in terms of getting this comprehensive care center. So what that means very clearly to me is that there's a way to do this. Again, if we have a hospital, we're talking about thousands of people's jobs, not the 400 that they're talking about, which is 8% of the population of employees who are at the St. Vincent's campus. 8%, that is not going to re-stimulate or revive the economy that's suffering in that area. But more importantly, a hospital is going to give us the quality of care that we need and that we deserve for the community, that is in the ballpark of dollars that we're talking about. So if we're able to get this comprehensive care center, we would be able to use the same amount of money, same donation of property to rehabilitate and adaptively reuse the Coleman facility and actually have a hospital. Furthermore, once that hospital is there, we'll be able to bring in federal revenue streams that wouldn't be available to us for a comprehensive or urgent care center. So the good news is the community is absolutely on board with a clear message that the hospital needs to be restored there, that it can be restored. It is now up to our elected officials, our public servants. This is a defining moment in this struggle as I stand here 10 months into this exhaustive struggle for a hospital. This is an opportunity for our elected officials to say to the Rudin Development Corporation, to LIJ, thank you for being interested in having a discussion about healthcare, and we need to go back to the drawing board and we need to make this work in a way that actually protects the healthcare needs of the community. This is the moment for our elected officials to do just that. They cannot yield to the powerful interests of real estate and of other influential financial interests. They must be the representatives for the people, and this is their moment in history as we stand here today. I hope that this is just a trial balloon, and I hope that in a couple of weeks or months we will see a new plan, and we want to be able to have a seat at the table as well. The Coalition for a New Village Hospital is 6,000 members strong. We have been trying to meet with the Rudins, we've been trying to meet with LIJ, we've been trying to meet with the elected officials. We are reasonable people. We are just in the state that we're in because we are in a health crisis, and we cannot afford to lose necessary health care for our people.
Well, I was going to ask you, have you reached out to the Rudin family?
We have several times, and now is a very pivotal time, as I said. When I made a public plea tonight to please meet with us, that we want to be sitting down with them, and we believe that there's a reasonable solution here that takes into account their interests, but also preserves and cares for our community.
And what did you think about the meeting?
You know, like I said, I was very disappointed that there weren't elected officials here. I understand that Speaker Quinn was here for a very short time. I wasn't able to be here when she was, but there were no elected officials here for the overall duration of the meeting, and that's unfortunate. But the good news is the community we are a smart and intelligent community, and we weren't fooled, and people understood very clearly that when they tried to talk about being able to treat a heart attack or a stroke, that's absolutely not what's going to be available at a facility like this.
Okay, last thing. You mentioned something that's going to be happening, the coalition is arranged.
Very important. Now more than ever, we need to get out on April 30th for a one-year anniversary rally that the coalition, in conjunction with 50 other community organizations, is organizing. If we don't show up in mass, they'll be able to do these deals. We need to move these deals from out of the back rooms and into the streets and into the public transparency that we deserve, and it's the only way that's going to make this actually happen in a way that's fair and usable for our community. So April 30th, please get out and join us. Tell your friends, get involved. If you would like to be a sponsor of the event on April 30th, please go to www.demandahospital.blogspot.com and send us an email. Let us know that you'd like to become a sponsor, and please get the message out April 30th.